Welcome to today's webinar entitled Healthy Aging and Your Memory, Understanding Alzheimer's Disease and Current Approaches to Prevention and Treatment. My name is Dr. Gary Zammit. I'm a clinical psychologist and pharmacologist, and I'm president and CEO of Clinilabs, a contract research organization that conducts clinical trials in the field of Alzheimer's disease and memory impairment. The focus of this presentation is going to be on the background information related to Alzheimer's disease. We will discuss the symptoms of the disorder, risk factors for Alzheimer's disease, its prevalence, and current and new treatments. At the end, I'll focus for a moment on new research in the field of drug development that may lead to new and promising treatments for this disorder. Let's begin by discussing cognition and memory. Cognition relates to our ability to think and involves functions such as attention, concentration, and memory. Memory specifically relates to our ability to remember information that was previously known to us. Short-term memory involves information from our recent past, perhaps what we ate for breakfast today, or a birthday celebration of a loved one last week, or even a recent news event. Long-term memory involves information from our distant past, memories of old friends, memories from our old neighborhoods, memories of our parents, and other events from childhood or young adulthood that most of us can easily recall. There are normal age-related changes in memory, and we know that forgetfulness can be a part of normal aging. Short-term memory and long-term memory may both be involved. And as we get older, performance on memory or learning tasks may be poorer than when we were younger adults. This is a normal part of human aging. However, health problems and medications can result in memory loss. So, for example, medication side effects, vitamin B12 deficiency, drinking problems, tumors or infections in the brain, blood clots in the brain. All of these things can have a negative impact on memory. We even know that some thyroid problems or kidney problems or liver disorders can also lead to memory loss. And it's not just physical problems. Sometimes emotional problems such as stress, anxiety, or depression can make a person more forgetful. Someone who's coping with a recent retirement, or someone who's coping with the death of a spouse or a close relative or a friend, might be emotionally impacted, and those emotional impacts can have an effect on how memory functions. All of these problems, the forgetfulness that goes along with normal aging, health problems and medication problems, these are not Alzheimer's disease. These represent different types of memory issues that we experience as human beings, but they're not Alzheimer's disease. Alzheimer's disease is something quite different, and although sometimes these normal changes or health or psychiatric-related changes might masquerade as Alzheimer's disease and be interpreted as Alzheimer's disease, they are not. Alzheimer's disease is something else. Alzheimer's disease is a form of dementia. Dementia is a global term that refers to decline or impairment in cognition that is significant enough to interfere with a person's functioning. There are different types of dementia, such as vascular dementia, that's the result of a stroke. But Alzheimer's disease is by far the most common form of dementia that we know of today. So what is Alzheimer's disease? Alzheimer's disease is a cognitive disorder, and we've already defined cognition, a cognitive disorder that is characterized by an insidious onset and gradual progression of impairment in one or more cognitive domains. In Alzheimer's disease, there's clear evidence of a decline in memory or learning functions, and that decline is steadily progressive and gradual without any extended plateaus and without spontaneous improvements. So in Alzheimer's disease, once somebody begins to lose functioning and that functioning begins to decline, it's a steady decline. Functioning doesn't spontaneously improve, and it doesn't flatten out for long periods. It is a gradual, steady, downward slope. Now, the symptoms of Alzheimer's disease can be summed up here, with memory impairment being the hallmark symptom of the disorder. Alzheimer's disease may initially impact short-term memory, but long-term memory is implicated as the disease progresses. People with Alzheimer's disease also experience communication and language impairments. They may have word-finding difficulty. They may have difficulty with semantic memory. Semantic memories are the types of memories that specifically relate to knowing the meanings of words and actions, and can impact them and therefore our communication and language. It can be a diminished ability to focus, with problems paying attention and concentrating, poor reasoning or impaired judgment, and even visual misperception. This is kind of a summary picture. I'd like to go into these in a little more detail by presenting to you the top 10 warning signs of Alzheimer's disease. And these have been adapted from material presented by the Alzheimer's Association. The first sign or warning sign of Alzheimer's disease is memory loss that disrupts your life. Forgetting recently learned information, dates, important events, a doctor's appointment, an important phone number, or perhaps the path one walks to get to the grocery store. And this memory loss can be significantly disruptive. It can be mild, but also significantly disruptive to the sufferer's life. We don't really know, and sometimes it's difficult to discern, whether there's a problem with memory consolidation, that is, with memories getting into the mind, or with memory retrieval. That means getting them out. But we do know that there is a problem with that memory loss, that ability to remember that is the hallmark of Alzheimer's disease. People with Alzheimer's disease have challenges in planning and solving problems. They may have trouble following a plan, like a recipe or a set of directions. These could be simple plans or complex plans, but they have trouble following them. They also take longer to handle common problem-solving tasks, like paying bills, or perhaps making a purchase, or perhaps trying to plan a travel schedule, maybe how to travel to get to their children's home, or how to travel to go on that long-desired vacation. All of these things can become quite challenging for the person with Alzheimer's disease. Number 3 warning sign is difficulty completing familiar tasks at home, at work, or at play. Now, these are familiar tasks. These are things that we remember for long times, like tying our shoes, familiar to us. So we might forget something like driving directions, or forgetting the rules of a familiar game. Perhaps it's that card game, the bridge game, or the hearts game, or the gin rummy game that one has played over and over and over throughout one's life, and suddenly the rules aren't clear anymore. Number 4, confusion with time or place. A person with Alzheimer's disease may lose track of the month, or the day, or the date, so there's a disorientation to place and time. They may not be sure where they are, or how they got there. One common question that the neurologist or doctor may ask to the person in doing evaluation of Alzheimer's disease is, where are you now? Looking for that answer, I'm in a doctor's office. What kind of building are you in? School, a house, an office building, a hospital? People with Alzheimer's disease may lose track of that. Number 5, trouble understanding visual images. So people with Alzheimer's disease may, at simple levels, have trouble reading the written word on a page. They have trouble reading a book or a newspaper. They have trouble reading and interpreting the images on a television screen. Sometimes they have trouble even with their own facial recognition. For example, they may walk past a mirror, see themselves in it, and not recognize that it's actually them. Or they may be walking down the street, searching for their home, not recognizing their home when they see it. So trouble understanding visual images. Number 6, problems with written or spoken words. People with Alzheimer's disease can develop what is known as anomia. That means they're not able to name things. They have word-finding problems where they can't complete sentences because they're searching for the right word, but they just can't find it. Or they're pointing at something and they know what it's called. They might be pointing at a stool, but they can't come up with the word stool. It's that sitting thing. It's that chair-like thing. It's hard to find the word. And they may be likely to repeat themselves or suffer from a circumlocution of speech. In other words, they're kind of talking in circles, repeating themselves over and over again in conversation. Number 7, people with Alzheimer's disease may begin misplacing things. They may misplace their belongings. They may be putting things in unusual places or unfamiliar places. And it can be particularly frustrating, say, for example, when the person with Alzheimer's disease wants to remember a phone number, but knows that she won't be able to remember the number. So she writes it down and puts it away in a safe place. But then she can't remember where that safe place was. And because of these faulty memory problems, the person with Alzheimer's disease might think that terrible things are going on in their home environment. Somebody's stealing from them, or somebody's moving things on them, when in fact that is not the case. Number 8, people with Alzheimer's disease engage in poor judgment. They may make poor decisions, such as purchasing unnecessary items, making poor decisions with money, or poor decisions with regard to their personal safety. These are also found in people with Alzheimer's. Whoops. And as we get to 9 and 10, people with Alzheimer's may withdraw from work or social life. Well, they're impaired, and that difficulty in functioning leads them to remove themselves from once familiar and enjoyable activities. They retreat into isolation and privacy because it's too taxing for them and sometimes too upsetting for them. And then finally, the 10th warning sign, changes in mood and personality. People with Alzheimer's disease can suffer from depression, anxiety, irritability. They may be easily upset. They may show behavioral changes such as agitation, and these things can occur in conjunction with Alzheimer's disease, or sometimes they can even be reactions to the symptoms. As I suggested, somebody can be very frustrated with their memory loss and with their level of impairment, and that promotes this feeling of detachment and depression and irritability. So now that we've kind of defined what Alzheimer's disease is, how common is it? I'm sorry to tell you that it is quite common. It is the most common form of dementia in older adults today. Estimates indicate that as many as 5.4 million Americans suffer from Alzheimer's disease today in 2014. The disease usually begins after the age of 60. It affects about 5% of people aged 65 to 74, and it affects nearly 50% of people aged 85 and older. The prevalence of Alzheimer's disease has doubled since 1980, and by 2050, it is expected to affect between 13.5 and 16 million people. Overall, Alzheimer's disease is a significant public health concern. So what are the risk factors for this disorder? Well, there are a few. First is age. As I indicated, it's commonly affecting people over the age of 60, although there are younger people who do have memory declines consistent with the diagnosis of Alzheimer's disease. Family history is a risk factor. If you have a first-degree family member, mother, daughter, brother, sister, husband, son, with Alzheimer's disease, your likelihood of having Alzheimer's disease yourself is significantly greater than if you had no first-degree family member with the disorder. And there is an association between cardiovascular disease and the risk of Alzheimer's disease. High cholesterol, high blood pressure, for example, are associated with higher risk of Alzheimer's disease. On a mechanistic level, we know that Alzheimer's disease is associated with a couple of things going on in the brain. One is the development of neurofibrillary plaques. Plaques are small clusters of proteins that exist around nerve cells, and they interfere with the transmission of information. These plaques form when proteins called beta amyloid clump up together. The beta amyloid actually comes from a larger protein that's found in the fatty membrane surrounding the nerve cells, but these little clumps of beta amyloid are very sticky, and they gradually stick together to form these plaques. And the clumps block the transmission of information between nerve cells. And they also may stimulate the immune system so that it actually triggers inflammation and results in the destruction and disabling of nerve cells in the brain. Neurofibrillary tangles are another phenomenon occurring in the brain. These are twisted strands of protein. These tangles destroy nerve cell systems that are made of proteins, and essentially the nerve cells, which are organized into pathways so that food molecules and cell parts and other material can move through these pathways. What happens with the tangles is that these pathways get destroyed. A protein called tau, T-A-U, is something that helps the material in the pathways flow through the cell. In the areas where the tangles form, the tau collapses into these tangles, and thus the pathways are no longer open and no longer enable the material to flow through. So this is what's going on in the brain. Now, this graphic is a fairly simple graphic which gives you an idea of biomarkers that may help us to identify people at risk. There are three stages: stage 1, stage 2, and stage 3. At stage 1, the person is in asymptomatic amyloidosis. In other words, they have plaques, but they don't, in the brain, the plaques that we were just talking about, but they don't have any symptoms of memory impairment. Now, the people at stage 1, they may go on to develop memory problems later on, but not necessarily. Just because they have plaques doesn't mean that they're going to absolutely develop Alzheimer's disease. So some people will be fine. Some people will develop memory impairment later on. In stage 2, people have the amyloidosis plus neurodegeneration. These are the tau collapses that we were just talking about, those pathways that collapse. Again, if you have this, it doesn't necessarily mean that you're going to develop Alzheimer's disease. But some percentage of people who have this will move on to phase 3, or stage 3, in which they have amyloidosis, neurodegeneration, and subtle cognitive declines. There begins to be evidence of subtle changes from how the person was performing at baseline to how they're performing now in stage 3. They may perform more poorly on cognitive tests. Now, they don't meet criteria for mild cognitive impairment yet, or for Alzheimer's disease, but those subtle changes are there. Interestingly, people who reach this level of stage 3 may begin to show signs of decline consistent with mild cognitive impairment and then ultimately Alzheimer's disease. Now, I've just introduced this term, mild cognitive impairment, so I want to define it for you. Mild cognitive impairment refers to a condition that people have when their memory problems are worse than, or when their memories are worse than healthy people their age. So the symptoms of mild cognitive impairment are not as severe as Alzheimer's disease. And, in fact, people who suffer from mild cognitive impairment, or MCI, they're able to engage in their usual day-to-day activities. The occasional forgetfulness is really the hallmark of MCI, and it's these episodes of forgetfulness that begin to concern the patient and might begin to concern family and friends. Some percentage of people who have MCI are going to progress to Alzheimer's disease, and it is now well known that Alzheimer's disease may begin years or even decades before it's diagnosed. So it's in that stage 3 where we see these very subtle changes in memory that then advance to MCI, that then advance to Alzheimer's disease. This graphic shows you an illustration of the trajectory of what Alzheimer's disease looks like. If you look at the left vertical axis, it's reflecting cognitive functioning. Higher is better, lower is worse. And on the bottom horizontal axis, you're seeing years or age. This is reflecting an aging person. And what you can see in the solid line is that cognitive functioning declines as we grow in years. It declines a bit with aging. That's a normal age-related change in cognitive functioning, in memory, as we age. But people who suffer from Alzheimer's disease take a different course. those preclinical findings may be there, the plaques, the tangles, without any evidence of memory impairment at all. But then the memory impairment begins to show up, and it shows up ever so gradually, perhaps very difficult to tell from the effects of normal aging. But as time goes on, the memory impairment continues to worsen to mild cognitive impairment, and then precipitously and gradually declines into dementia from which there is no recovery. So the trajectory of the person with Alzheimer's disease shows a persistent, gradual decline in cognitive functioning that is quite different than from what we experience in normal aging. So there are treatments available for Alzheimer's disease. These include drugs known as cholinesterase inhibitors. These drugs prevent the breakdown of a substance or a neurotransmitter known as acetylcholine. Acetylcholine is a chemical messenger that is critically important to learning and memory. So by preventing the breakdown of acetylcholine, the brain is supported, communication among nerve cells is supported, and the cholinesterase inhibitors help in this manner. These medicines have been shown to delay the worsening of Alzheimer's symptoms for about 6 to 12 months on average for about half of the people who take them. They're generally well tolerated by people who take them. The frequency of adverse effects or side effects is not too much higher than placebo. These side effects include things like nausea, loss of appetite, and perhaps more frequent bowel movements. There are other medicines that are used in the treatment of Alzheimer's disease that can address the specific psychiatric or behavioral symptoms. Antidepressants to help with depression, anxiolytics to help with anxiety, and sleep medication to help with insomnia. So some medicines will help memory, other medicines may help the associated symptoms of Alzheimer's disease. There are many alternative treatments that people have explored, herbal treatments and other types of medicinal foods. I'm not going to go into those, but they are out there, and you can learn quite a bit about them on some of the informative websites on this topic. Now, aside from the existing medications, there are emerging therapies. There are new drugs in the pipeline. And these drugs are focusing on a few different areas. One is on symptomatic treatment. Just like the cholinesterase inhibitors that I just talked about that reduce the symptoms of memory impairment, well, other symptomatic treatments might focus on other areas of Alzheimer's. Bupropion can target apathy, mirtazapine, insomnia, citalopram, agitation, and brexpiprazole, agitation. These are symptomatic treatments. There are then disease-modifying treatments. These are treatments that try to address the underlying cause of the illness. These are treatments that might be targeting neurofibrillary plaques or tangles, tau, and so on. There are regenerative types of therapy in the pipeline. These are regenerative therapies that attempt to repair broken nerve cells, perhaps by using stem cells or growth factors. And then finally, there are preventative therapies that are aimed at delaying the onset or preventing Alzheimer's disease altogether. I think it's fair to say that in the industry today, there is less attention being paid to symptomatic treatment and more attention being paid to disease-modifying, regenerative, and preventative treatment for Alzheimer's disease. And one of the reasons for that is that the symptomatic treatments that are available have shown to produce modest improvements or modest help for a short period of time. The pharmaceutical companies that are engaged in this area are looking for greater returns on the therapeutic investment, if you will, in getting a better treatment outcome. In addition to what I just mentioned about drugs in the pipeline, you can learn much more about clinical trials of these pipeline medications and investigational drugs by going to a government-supported directory of clinical trials. That is www.clinicaltrials.gov. If you type in the search word Alzheimer's disease, you can search for clinical trials in your geographic area. If you're interested in clinical trials at Clinilabs, at our New York City and New Jersey clinics, you should know that we have studies ongoing and studies anticipated. We are seeking healthy elderly people for participation in a prevention trial, and we're seeking subjects with mild cognitive impairment and Alzheimer's disease for treatment trials. Our database is very active, so it's constantly being refreshed, and candidates with interest can be contacted at any time if they wish to be. The important thing is to, if you're interested, get your name in the database. The prevention trial that we're doing now is really aimed at assessing the effectiveness of a medication in delaying the onset of Alzheimer's disease. It's called the Tommorrow study. In order to participate, people have to be between 65 and 83 years of age and in good physical and mental health. They can not have a history or diagnosis of cognitive impairment, dementia, neurological or psychiatric disorders, or any other diagnosis that might affect their cognitive performance. And they have to have a project partner, such as a spouse, that can go through the study with them, because the partner will be involved in helping to provide information and rating the person as they go through the study. It's a very interesting project, and it is one of the few studies and a newer study that is being done under the new Food and Drug Administration guidance for the development of medication to treat Alzheimer's disease. This falls into that prevention category. For more information, please do contact us by telephone. Our phone number is here, 212-994-4567. You can visit us online. You can send an email to us, or you can text us to volunteer to 313131. We do accept walk-ins at our clinics, and occasionally we will sponsor free memory screening days so that people who are interested in getting their memory assessed can come in with no obligation and at no cost to get a free memory screen. Okay, so that's it. Well, thank you very much for listening. I do have the opportunity for questions, and I'd be happy to take a few moments to answer them. We're just a little bit over time here, but I think we can take a couple of questions. The first question is, what is the Cognex and what does it do? Well, this question, I believe, relates to the drug named Cognex. This was an early cholinesterase inhibitor, and physicians don't prescribe it too often now because it has more side effects than the other cholinesterase inhibitors that are available today. So this early one is not so commonly used, but it functions, it is a cholinase inhibitor, and it functions in a similar way to the other drugs in its class. Okay, all right. My mother was diagnosed with Alzheimer's disease, but before she got the diagnosis, we weren't sure if her memory problems were normal or not. How do you tell? Well, since Alzheimer's disease has a very slow and gradual onset, memory problems can begin as mild ones and then get progressively more severe. So it can be hard to tell when a person begins to cross the threshold from the effects of normal aging to mild cognitive impairment to Alzheimer's disease. As they progress, it becomes easier to tell, but in those early stages, it can be difficult. If you're worried and maybe concerned that you have a first-degree family member who had Alzheimer's disease, if you're worried that you or perhaps a loved one might be having a problem, the best thing to do is to speak to your doctor. You can get a referral to a neurologist who can complete an assessment. The neurologist might even send you to a neuropsychologist who will do some formal memory testing to see if your functioning is consistent with your age group or if it appears to be impaired relative to others in your age group. Getting the results can oftentimes help put your mind at ease. How is Alzheimer's diagnosed? Well, this is a lengthy, discussion. There's really no single definitive way to diagnose Alzheimer's disease, but we do today diagnose it on the basis of clinical presentation and neuropsychological tests, and we also may do brain scans to determine if the brain abnormalities that I just talked to you about today are there, and there also may be some biomarkers that a physician may use, but I think that's less likely. Most commonly, this is a diagnosis that's based on the clinical and test findings, and again, there's no one size fits all. Can you prevent Alzheimer's disease by keeping your brain active or by using a website like Lumosity? Well, keeping your brain active and keeping yourself stimulated is something that is associated with a lower risk of Alzheimer's disease. Older people who continue working, who are volunteering, who are reading, and engaged in mental activity are perhaps at lower risk, and studies are ongoing in people who are doing this. I can't comment specifically on Lumosity. I know that studies are going on with that particular website service to see if it does help to improve cognitive performance in older people with mild cognitive impairment. I think we'll see more information coming out about this as these studies complete and get reported. Okay, I see we're a little over time. We're over time already. I see other questions coming in, but in the interest of sticking to our time schedule, I will thank all of you for participating in the webinar this evening. It's been a pleasure to speak to you, and we welcome your questions and comments and your participation in clinical trials. Thank you very much.